So I tried to call my doctor's office to try to talk to the on-call. Apparently they haven't called back yet. I did call the fire department to see if they could just quickly look at my neck. They didn't look at my neck. They said that they're not doctors. When I asked them if they could do an EKG, at first they said it's unrelated. And then he said, but we can take your blood pressure. And so he took my blood pressure, and then I explained that, earlier I was having some kind of acid reflux kind of thing. I don't know I can't find the words right now. And that I experienced a little bit of chest pain and a little bit of pain in my arm. It wasn't like it left, like it wasn't much. Yeah, they asked me if I wanted transport. The EKG was normal. They ended up doing an EKG after I explained that. They're like, well, if you want, we can do an EKG. After I had told them about the chest pain, etc. And they said, we thought it's normal, whatever. And yeah, I'm just kind of missing Arizona. When I was at EMT, we had a whole, slew of things that we had to do with every single patient. There was no thought of bias or anything. We, I don't know. We palpated their neck gently to feel if there was any enlargement or etc. There was just certain things that we had to do when we're looking somebody over. And I don't know, it feels so backwards, here. They don't, when you go to the doctor even, I don't know, I've had a couple doctors where, they don't even listen to your lungs anymore. They don't take a listen to your heart, they don't do any physical exams. Basically, they try to think about what is what they think would be acute, and it's just very small-minded, in my opinion. And you tell them that you may have a lump in your vein. It's it may be in your vein. It does feel like it's changed shape. And traveled some, and so I'm still a bit concerned. I don't know, maybe I broke it up some, if it was a clot or something. I don't know, but it's not it was more hard and pea kind of shaped before. Now it's more elongated and a little bit softer, and it's just farther down. And I am getting some pain in my left arm, but it might be just because I've I aggravated a nerve or something when touching it. I tried to mark where the lump was whenever I started feeling like it was moving. But yeah, I am just disappointed, in emergency medicine right now. Like, it's just a far cry from what I remember it being like, 10 or 11 years ago. Like, it was, in my home state. I guess in training with, like, in the paramedic that got me into it, like, and took me on calls and stuff, like, he was by the book, and he, like, really, really took care of his patients. And, like, I don't know, it's, you don't know if something else is, like, I don't know. They said my refusal, they believed, was a wise decision. But that's kind of how they treat all of my medical, like, things. Like, anytime they have like, an acute emergency, like something that's acutely wrong, like whenever I had my first POTS episodes and everything, and I was dizzy and, like, I needed help. I didn't know what was going on, and I felt like I was dying because I did not, you don't know, and it feels really, really scary. It feels like there's just so much gaslighting and just dismissal of symptoms and dismissal of patients. And I don't know if it's like, I remember watching a video about, like, patient dumping, and I'm not sure if just this, like, region where there's a lot of bias towards people of different economic statuses, like, or if they truly just have a different rubric than the national standard. Because when I was an EMT, we had to do state level and national, and it was pretty parallel what you're supposed to do, in every kind of emergency, like, situation, like, with a patient. And so it, I don't know, it is concerning to me, like, hardcore concerning. Enough that I may have to try to contact, like, the national, emergency people. I can't remember the name. The people who certify, like, emergency personnel, and, like, discuss it, because I try to talk to my doctor about it, and I try to ask her, whether or not standards have changed, and, like, because of what the nurse had said last time when I wanted him to evaluate me for a concussion because I was so dizzy. I could barely, like, walk out. I couldn't walk out at the time. I almost, like, felt like I was gonna fall, and I finally had to sit down, and it took a while for me I needed help from my son to get me out to our taxi because I was still very dizzy and off balance, and I still haven't pulled that record. I need to pull that full record to see what they said, because in my last record, it described me being, like, my gait being appropriate for me to be walking out of there. So if they had that standard, in that report, then my gait not being appropriate last time should be, like, I don't know. I talked to a patient advocate yesterday, I believe it was, and she said she did talk to the emergency, like, department, like, supervisors or whatever, about the other issue, and then I had to bring to highlight the, ultrasound issue. And I don't know, I just get the feeling that patient advocacy isn't about advocating for the patient. It's about giving the hospital the upper hand in any kind of legal malpractice suit. It's not. It gives them time, like after you've told them, to go and cover things up, like what they did with the MRI potentially, if the other doctor and his assistant were being honest and not trying to make me believe I had an illness that I didn't have, and also dismiss my having mast cell activation syndrome, because he didn't even look, he didn't even I don't know. It was just a situation, but I don't know. I don't know. I'm just kind of disappointed all the way around right now, and I just am really missing. I've experienced bad things, in the hospital, in the hospitals in Arizona. I went in one day with horrible, painful rectal pain, and drove myself in. It was far, and I the doctor, or they gave me some kind of pain medication, and they gave me a lot of it, a high dose of it. I had two pills, I think it was codeine or something. And then the doctor proceeds, they made kind of a joke about me and this other woman who were in the waiting room, you guys are feeling good or whatever. And then the doctor comes and talks to me, and he asks me if I still want the procedure, because I think we had already talked or something. I don't know. He said that they were gonna need to do an exam to look inside my inside. Anyways, they it was an ultrasound or something, and he thought that if I got loopy enough or something, then I would, that maybe I was just a drug seeker or something, and decided he was gonna drug me up. There was a lot of people in the ED that night, and it's not an excuse, but but I think that they were just trying to, I don't know. When I told him, because he explained it was going to be painful, and it's going to be this or that, and was trying to almost talk me out of it. I was like, yeah, I still want it. I still want the procedure. Something's wrong, because I had been experiencing some really rough symptoms, and then this pain just wasn't going away, and then the symptoms kind of continued after that, even after the diagnosis that they made, and it ended up interfering with my work, and ended up losing my job and that. And anyways, what am I just saying? I don't know. And I experienced some things while I was an EMT, actually, in doing my first ER rotations as a student. I experienced some behavior towards patients that was not correct. And so I don't know. There was a corruption. They always said it takes a special person, because special personality or something to work in ED. But I don't know. I'm not sure what the issue is. It's just there's just no empathy. Almost I mean, it's not just no empathy. Maybe it's just like a laziness or something. Or feeling like they can get away with it, or I don't know, this bias based upon your looks, the way you look, or your income, or maybe notes from prior people or something, or I don't know. All I know is I'm sick of it. I'm sick of not having not feeling like I'm getting the standard of care that I'm supposed to be getting. And I know that I'm not because I've gone through, the training that I have. And then when I'm reading online, what this is could be, and then they're refusing just to even look. They don't want to palpate. They don't want to do anything like that. It's almost like you're begging the personnel to do what they're supposed to do. And it feels so humiliating. I feel so humiliated every time I ask for help when there's an issue. And it shouldn't be like that. It really, I don't want to go back to the ED. It was a horrible, my last experience there was, I think, the staff was pretty nice. They were nice, but it was the medication that they gave me, and then the lactated ringers, or whatever. The combination of the drowsiness and from that medication and then the burning in my lungs, and then them saying that they did particular things that they didn't do in the report, and then there not being a record of the ultrasound when there was clearly it was clear they saw something there. And just them I just don't want to go back, and I don't want to. I don't know. I feel disappointed in my doctor today too, because I asked for them to transfer my referrals to a different place, because the hospital couldn't get me in.